Hey there, and welcome back to another podcast of Heal Without Harm, the show that pulls back the curtain on our broken healthcare system and gives you real tools to feel better without meds, injections, or unnecessary surgery. I'm your host, Dr. Clayton Dir, physical therapist and movement optimist. Today, we're talking about a super common diagnosis that might not mean what you think: hip bursitis. If you've been told you have it, Googled your hip pain and came to that conclusion, something like that, just hang tight, because there's a good chance that's not actually what is going on. I've got to tell you, this is probably one of the most common things that comes into our clinic is someone who has been diagnosed with this or self-diagnosed. Let's define what hip bursitis truly is. The bursa, which is bursitis, itis is irritation of that bursa sac. It's a tiny fluid-filled sac that reduces friction where tendons or muscles pass over bones. So imagine you have a rope that's going around a corner and it's going to keep moving. It's going to rub and wear out eventually. But if we put a little bursa sac there, this little thing that reduces friction, it actually makes things not only more efficient, but break down a little bit less. Now, you've got one near the top of your hip. It's called the trochanteric bursa. Big fancy word, I know. Now, this is not that hip bone that you'll set a baby on. It's a little bit lower than that. It's actually a portion of your femur, which is the thigh bone. When it gets inflamed, that bursa sac that we keep talking about, when it gets inflamed, that's called hip bursitis. Now, textbook, it's going to tell you that the classic signs are pain on the outside of the hip, especially when you're laying on that side or if there's any sort of pressure, going up and down stairs, or standing after sitting for even just a short period of time. The other thing that I've seen too is on the few times that someone actually has hip bursitis, you will have something called rebound pain, which means that if you use the hip, it is not painful. But when you sit to rest, sometimes that pain will actually increase when the load comes off of that hip. Now, I know this sounds straightforward, but here's the thing. Just because the pain is there does not mean the bursa is the problem. That's why this gets so complicated sometimes. Most people I see with hip bursitis diagnosis don't actually have an inflamed bursa. They most likely have glute tendinopathy, another fancy word for saying the glutes, the muscles of your hip, have some sort of tendinitis or tendinopathy. It's a fancy way of saying those tendons, especially the glute medius, because you actually have 3 glute muscles, are irritated and or overused. This presents almost identically to bursitis. And honestly, you can have both at the same time. And in most cases, it's the tendon that's the primary issue, not the bursa. Honestly, the tendon is usually the issue, and then the bursa is the one taking on the load and is actually usually the secondary issue. Why does this matter? I know that's what you're asking. Because the treatment is totally different. Let me put it in perspective. If you truly have bursitis, and that's the only issue, somehow magically, that's the only issue, we're first going to tell you to rest. And then if things get really bad, we're going to look at anti-inflammatories, pills, cortisone shot, something like that. But tendinopathy, that needs strengthening, load management, meaning don't do too much or too little, and proper movement retraining. Otherwise, the pain's going to come back again and again. And actually recently, about a month ago, maybe 2 months, a news article came out that said 50% of people who are middle-aged that have hip pain are not going to have it go away on its own. Meaning you have a 1 in 2 chance of this sticking around until you actually do something about it. And I will tell you what, if it's tendinopathy or tendinitis, that cortisone shot may make the pain go away very short term, but it is not going to solve a single problem. Let's get into this. Most primary care visits, by the way, we're getting into why this is misdiagnosed. Most primary care visits, meaning you just going to the regular doctor, lasts under 10 minutes. You walk in, you say, I've got pain on the outside of my hip, and then boom, they diagnose you with hip bursitis, they're done. But without testing the tendons, checking the movement patterns, or looking at why your hip is actually irritated in the first place, ultimately it's just a guess. You are walking in there, you've said the right things, they diagnose you with hip bursitis, and they send you out. The big kicker is imaging, or taking pictures, MRI, X-ray. It doesn't always help. Honestly, an MRI might show bursal inflammation, meaning irritation of the bursa, or tendon changes, but it still does not tell us what's causing your pain or how to fix it. That is where a good physical therapist makes a huge difference. And again, if I can bold and underline a good physical therapist, I would do it. There's a lot of physical therapists that I've worked for,
who simply don't know how to properly evaluate, diagnose, and then treat the issue. Now, if you've been told you have bursitis, please don't panic. Don't rush to injections or surgery. Honestly, just start with these steps. Stop putting your body in aggravating positions like lying on that side or crossing your legs. This is just temporary until we get the pain down. Next, you're going to strengthen your glutes. This is not just doing some bridges. We really need to focus in on all the areas that are painful, honestly. Most of the time, that's going to be the glute medius or the glute minimus, or potentially both. Exercises that you can do to fix this, or at least start fixing this, is going to be 7-way hips, which I have on my YouTube channel. Exercises also like side-lying leg lifts, banded walks side to side, and even step-ups. But I'll tell you what, that step-up one is definitely going to be a further down the line progression. Another one is fixing your movement. Are you overloading one side? Are your hips compensating for weakness in the ankles, the knees, somewhere else? If this is starting to get a little bit complicated, this is why I honestly just recommend people getting evaluated by a proper physical therapist who knows how to differentiate between tendon and bursa issues. If you don't get diagnosed correctly, you're not going to get treated correctly, and therefore you're not going to get the results you're looking for. Most cases resolve with the correct approach and the right diagnosis. But if you don't have those, you can't expect proper results. Now, this was a very quick one just to expose you on whether or not you have hip bursitis and that there's a high likelihood that you don't have hip bursitis. It's probably a glute tendinopathy, and that's why you're so frustrated, and that's why you're listening in for today. So I've got a couple links in my bio that I would love for you to go check out in the podcast notes to reach out to me if you have any questions on this. But for starters, I would like you to start strengthening up that hip as opposed to just getting an injection or taking another pill. For today, thank you for tuning in to Heal Without Harm. And if you found this helpful, please share it with a friend, a family member, a dad, a son, a daughter, a sister, somebody who has been struggling with hip pain, maybe even your coworker, or they're stuck in the cycle of shots and rest and shots and rest. Because honestly, we don't like that. We don't like big pharma. We want you to heal yourself. I am Dr. Clayton Dir, physical therapist, and I want to say, don't settle for the first label you're given. Keep asking questions, keep getting stronger, and keep healing the right way. And let's help everybody learn how to heal without harm. Thank you.